Thank you, Governor. Good afternoon, everyone. Happy fall and happy October. I have a different mask today. This is my Breast Cancer Awareness Month mask. So it allows me to use it as a reminder to please talk to your doctor about getting screened if you are older than 40 or if you have a family history of breast cancer. And thank you to Rhode Island Medical Imaging for the mask and for all they do to support breast health for people in every zip code throughout the state. I also want to echo the governor's expression of gratitude as we launch this subcommittee to the Vaccine Advisory Committee focusing on the COVID-19 vaccine. We are truly blessed in Rhode Island. I can say firsthand that everyone that we called as experts to join this committee was eager and ready to serve, knowing how much we have before us to make sure that Rhode Islanders can rely on a fair, science and data-driven distribution process for everyone that needs it most going forward. So it's something that I also want to express appreciation to all of our subcommittee members who will be joining with us in serving. In terms of our COVID-19 data for today, as the governor shared, we have 145 new cases. There are 107 people currently hospitalized with COVID-19 in Rhode Island. Of those people, 10 are in an intensive care unit and 5 are on a ventilator. Sadly, we have one new fatality to report today. This individual was in their 80s. Our prayers are with this person's family as well as all the families who have had to deal with a passing during this time, which isn't easy at all. As Governor Raimondo also shared, we are keeping a very close eye on our number of new cases. Our percent positivity is strong because of the amount of testing that's being done, but it's important that everyone stays vigilant. It can get tiring, the days can be long. COVID does not change in how it is transmitting. Those 3 W's, wearing your mask, watching your distance, and washing your hands, continue to be the core approach to keeping us all safe. To share a little bit more about the data, as it's important to dig into what we are seeing from the cases and share it with you in real time, social gatherings continue to be a problem area. And one of the main reasons is when people are socially gathering, they forget those 3 W's and think it's because it's a family member or someone that they know or that they work closely with or live near, that washing their hands, wearing their mask, or watching their distance is no longer as important because of the closeness to that individual. And we want to make sure that you know to change that. COVID does not care if they are a family member or a close friend or a close coworker. Wearing your mask, watching your distance, and washing your hands regularly continue to be the key, particularly with social gatherings. Between September 22nd and September 28th, we identified 719 new cases. 49 of those cases reported attending social gatherings, and as I've said in the past, people are not always totally forthcoming with us about whether they have attended a gathering, so the number could certainly be higher. And we still want to encourage you, share the information with us that's needed to help keep you safe. The people who went to social gatherings had an average of 6.5 contacts. In comparison, the number for the average positive case is just 5 contacts. And if your social gatherings are happening in nightclubs, bars, other places, that's an even bigger problem. Nightclubs specifically should not be operating right now. Our state compliance team is going to be taking a closer look at this issue in the coming weeks, and we'll be sharing more on that shortly. Two other things that are coming up in our case investigations are about break rooms and carpooling. If you manage a workplace and have a break room but don't need it, please close it. If you have a break room but you do need to use it, please have clear policies in place. Again, a break room is a location where people are gathering socially and forgetting the 3 W's. You need to still be wearing your mask when you're at the water fountain or getting something in the break room or just relaxing with colleagues. You have to continue to wear your mask. COVID, we have been seeing cases where people are in break rooms, their guards are down, and COVID transmission has occurred. In addition to wearing your mask, washing your hands, and watching your distance, keeping 6 feet between you and others, we're also asking people to keep a 4th W in mind. Also, watch your symptoms. If you have symptoms, don't go out unless you are going to get tested to further evaluate. In terms of carpooling, if you have to carpool, keep your mask on while in the car and keep the windows opened. And of course, the most important piece is please stay home if you're sick. We have a range of income supports for workers who cannot go to work because they have symptoms or because they have to quarantine. There is a federal paid leave policy that applies to all employees at firms with fewer than 500 employees, and we have state policies that provide paid sick days and temporary disability insurance. Independent contractors are also eligible for pandemic unemployment insurance if they must miss work while they quarantine or isolate. And undocumented workers can access We Are One funds at any point. This is important to make known to people. The We Are One Relief Fund provides direct cash assistance to Rhode Islanders who are unable to benefit from most public programs and emergency relief efforts due to their immigration status. Please spread the word on that. If you need to learn more, you can reach out to Dorcas International or call us at our information line 401-222-8022, and we will give you that information. In terms of schools, roughly 3 to 4 weeks in, we have fortunately not seen any major groupings of cases in K through 12 schools in Rhode Island, as the governor said. We are continuing to work with school and LEA leadership to make adjustments so we can better support them. We're extremely appreciative of their partnership, and it's what Rhode Islanders can look to with confidence in knowing how collaboratively and how strongly we're working together across the whole state of government response. As a reminder, we have dedicated K through 12 testing through the program that's available for any student, teacher, or school staff person to take advantage of. To schedule a test, call 844-857-1814. That's particularly those who have symptoms, or if you've been instructed by the Rhode Island Department of Health to call because you have been a contact. If you are a contact and you don't have symptoms, you will get a PCR test alone. If you do have symptoms, you will get that PCR test, and you will also get a more rapid test, which will allow us to start the contact tracing process more quickly if it turns out that you are positive. These more rapid tests are usually antigen tests, which are currently being processed by Eastside Clinical Laboratory. I want to give a special shout out and thank you to such a strong partner at Eastside Clinical Laboratory. They are a great Rhode Island company that has been a huge part of our state's response almost since day one, and we will stay connected in continuing a strong response going forward. The other educational environment that we're paying very close attention to is colleges and universities. Most of the college cases that we are seeing are still associated with congregate living, communal living settings where people are living closely together. However, I want to assure people that we are heavily involved with college and university leadership whenever we see cases. For example, we've been working with the leadership at Johnson & Wales to ensure that learning is happening remotely for the time being, and to get a stay-at-home directive that's been in place this week so that we can better understand the way to keep any cases under control specifically for that area. Similarly, URI has been working hard to stay in front of the cases that they have, and at Providence College, they're doing a 4th round of testing in advance of starting to move towards reopening after their case numbers have begun to stabilize. So we're going to be living with this virus for a long time going forward. We expect to see cases, especially among college students who are more mobile, as well as among those who live in congregate or communal settings. But with the steps that we're saying, it is possible for us to live with this safely, watching your distance, washing your hands, and wearing your mask. I want to thank the leadership at all of the colleges and universities who have acted swiftly and decisively in each instance where we've engaged together. And the leadership at schools without large numbers of cases are being extremely vigilant as well. So kudos to all of them, and we will continue that partnership going forward.